Good morning. A little energy. Good morning, everyone. What a beautiful day to be in Athens, and what a great day to be at this extraordinary conference. Thank you, Andreas. Your visionary generosity and philanthropy excuse me, is improving the state of youth mental health across the world. Looking at this incredible conference program and the attendees, including former President Barack Obama, should make it very clear that mental health is truly a defining issue of our time. Our focus this morning is child mental health, and that's the key to developing successful solutions to the global mental health crisis, because mental health disorders are disorders of our youth. 50% show up before the age of 14, and 75% before the age of 24. And left untreated, they become adult disorders. If there's any silver lining to COVID, excuse me, it's that the world is finally paying attention to this issue. Unfortunately, that's because the pandemic took a devastating toll on youth mental health globally, but more importantly, our children were already struggling. What if I told you that the number of people dying from cancer in your home country increased by nearly 60% in a decade, despite available treatment and prevention? You wouldn't believe it. And yet, deaths by suicide among 10 to 24-year-olds in my home country, the US, increased 57% between 2007 and 2018. In 2010, there were 4,900 suicides in this age group. In 2020, more than 6,600. Suicide takes more lives than the top 13 physical disorders. Let's repeat that. Suicide takes more deaths than the top 13 physical disorders combined. Let me just, oh good, they're taking care of this without me clicking. Thank you. And 90% of youth who die from suicide have a mental health disorder. Here's the most heartbreaking part of this, and that's that mental disorders are real, common, and most importantly, treatable. These kids don't need to die. Globally, suicide is the 4th leading cause of death for 15 to 19-year-olds, and in 2014, suicide was the #1 cause of death for adolescent girls. Over 200 million children and adolescents struggle with a mental health disorder globally, and those who don't get help are more likely to be chronically ill, unemployed, homeless, or incarcerated. And now here are some facts about what it costs. The World Economic Forum predicts that mental health disorders will cost the world economy around $6 trillion by 2030, more than the roughly $2.2 trillion projected for cancer, diabetes, and chronic respiratory disease combined. If you think this sounds dire, you're right. But we have solutions. So what's the holdup? Stigma and misinformation, shame around getting help, delayed diagnosis. Disorders often set in for years before families seek any help. In the United States, it takes 8 years from the onset of the symptoms till a parent reaches out and gets help, on average. So that means there are people like me that would take care of it in, 24 hours, which means there are others who are taking 10 years and hoping that their kids' symptoms will just disappear. The workforce shortages. There aren't enough trained clinicians for the scale of this crisis, and that's because there's a lack of training. We need better education around evidence-based practices for all health practitioners, and stalled research. There's so much more that needs to be done to understand biomarkers, develop personalized treatments, and digital technologies, and so much more than that. But there is hope. Since 2009, the Child Mind Institute has been relentless in our focus in transforming the status quo in the United States. We have collaborated with philanthropists, governments, research institutes, and experts to create a model for impact. We fight stigma and educate families with scientifically sound information. We identify and treat conditions early in schools and in our clinical centers, and we bring prevention programs into communities. And I think most importantly, we accelerate the pace of discovery and the development of better treatments by freely sharing our research data globally. We're working with states across the United States to build large-scale programs that get at these root problems. We developed a prevention campaign called Healthy Minds, Thriving Kids, which literally reached 72,000 California educators, and they reached 1.4 million California students. And now a follow-up called Positive Parenting, Thriving Kids project to promote resilient and more effective parenting. Our Youth Mental Health Academy launched yesterday, and it's recruiting and training thousands of highly talented and culturally diverse high school students to address workforce shortages. And our next generation digital therapeutic program will improve access and tools for remote care. Some of our partners are here. Let's just take a moment to really acknowledge how extraordinary they are. Jennifer Siebel Newsom, the first partner of California, and Dr. Mark Ghaly, California Secretary of Health and Human Services. They worked with Governor Newsom to fund these projects through the state's historic $4.7 billion investment in children's mental health. Let's just take a moment to say thank you. We are trying, by the way, very hard to get other governors in the United States to follow Governor Newsom's leadership. $4.7 billion is truly historic. Our federal government has not put $4.7 billion into children's mental health, and we recognize that without mental health, our children can't have physical health. But we're also experiencing a global mental health crisis, and help is needed worldwide. And that's what motivated me and Andreas. And by the way, in the middle of COVID, Andreas took me out to dinner in New York City. To remind you what that was like, we sat in a tent with a heater, and the food was cold, we were cold, and Andreas said to me, lean in, this is the moment to make sure we do something for children's mental health. I told Andreas he must be the only human on the planet who hasn't told me to step back, that I am overly enthusiastic, overly optimistic, but Andreas is truly a visionary. And it's because of that we put our focus onto Greece, given SNF's really remarkable health initiative, and to understand how the Child Mind Institute could collaborate with Greek mental health professionals to improve access to evidence-based care here. The result is that 2 years ago, we partnered with SNF to form the Child and Adolescent Mental Health Initiative, CAMI, a unique collaboration to enhance the capacity of the Greek public health sector to reach more kids and that they could get the care that they need. My colleague, Dr. Giovanni Saloum, will soon be joined on stage by an amazing group of Greek experts to discuss how this work is already having an incredible impact. And now CAMI provides a collaborative template for the Child Mind Institute's global initiatives. Because if we care about children, we have to go where they are. And 90% of the world's children live in low and middle income countries, but only 10% of mental health resources go to those areas. Dr. Mike Millam will speak to our emerging collaborations as part of the SNF Global Center for Child and Adolescent Mental Health at the Child Mind Institute, which will expand the work that we've done in Greece and take it to other countries. Children everywhere could benefit from this unique approach that creates innovative, homegrown solutions, and I hope that these presentations will inspire ideas for further collaboration and partnerships. Because in global work, the Child Mind Institute is not the driver, but it's a catalyst that helps accelerate access to quality care by partnering with local experts, creating local best practices, and developing digital tools. We are learning so much from our global mental health partners, including UNICEF, WHO, and the International Association of Child and Adolescent Psychiatry and allied professionals, all represented on the panel today. The Child Mind Institute's reach is increasingly global, but our impact remains very personal. As an independent nonprofit, we wholly are dedicated to transforming children's lives today. We work at the crossroads of clinical solutions, research solutions, and system solutions. We are nimble, we are ready, and we are so excited to partner with leaders across the world to multiply our impact. I thank you all for being here. This work is only possible because people like you show up every day for kids with mental health disorders. Thank you. They took the slide away from me, but we are going to watch a short video that really expresses some of the voices that we've been hearing from children, from mental health professionals, and from parents about the work that we're doing here in Greece and the collaboration that SNF and the Child Mind Institute has had by creating CAMI, the Child and Adolescent Mental Health Initiative. Thank you very much. I just want to remind you that the next panel will be both in Greek and in English, so it's time to put your earphones, your earpieces in. Thank you again.